Was it the right move to wind down the DSRTF?
I think it's irresponsible to abandon the work of the task force before we have the capacity here in Manitoba to meet patient needs. What the NDP announced today, expanding surgical slates, increasing machinery, those are, they all sound great, but they're solutions that take time and resources and staff. And I think what was completely lacking in today's announcement was a plan to get those staff into place. So those are longer-term solutions, but there are patients waiting for care today.
What do you think happens to those patients now? Again, if you're already in the process of having booked an appointment that will be honored,
My concern is with those patients that haven't yet got an appointment booked, that are waiting for the next steps in the process. This is going to delay their surgeries or their diagnostic tests. I think it's irresponsible, and I think it's an example of the NDP putting their ideology ahead of the needs of patients.
In terms of these new measures that were announced, were they in progress under the PC government, like more surgical slates at the Grace and hospitals?
Absolutely. I think the previous government was moving towards expanding capacity locally, but I think the role of government and leaders is to come up with innovative solutions that meet the needs of patients today and to do whatever it takes to get people out of pain. And if that meant sending patients out of province for surgery by choice, nobody was forced to go. They had the option of going out of province for surgery. I think most of those experiences were overwhelmingly positive from the stories that I heard during the campaign. I think it's incumbent on government to do whatever it takes to get people the care that they need as quickly as possible.
The health minister said it was, some of those surgeries were 7 times more expensive than how it would have been under the public system. Was that expense worth it?
I don't think you can put a price on human suffering. I think if you were to ask any of those Manitobans who are waiting for surgery what their priority is it getting the care they need quicker, or is it the cost to the taxpayer? They're going to say it's getting care quicker. And we're the Progressive Conservative Caucus. We're always going to be the party of fiscal responsibility, but I don't think you can put a price on patient care.
This task force was always meant to be temporary, and the health minister says that its time has run its course. You do think it's irresponsible? At what point would it have been right to wind this task force down?
When we have the capacity to meet those needs locally. And that's going to take staff, and it's going to take resources, and it's going to take time. What concerns me is that today's announcement sounds great, but there's no details to get those staff in place. You can't increase operating slates. You can't increase surgical capacity. You can't do more MRIs without the staff. They haven't told us how they're going to find those staff yet. That's concerning to me.
Looking back at the out-of-province surgical programs and the costs that were associated, was it the right call, though, to divert and funnel so much money out of province to pay for these procedures? Could it have been done? Could that money, could those dollars have gone further in Manitoba with maybe some different programming, some different planning? Do you stand by the out-of-province?
Well, I think you have to put it into context, right? The task force was established in the wake of an unprecedented global pandemic that created backlogs for surgeries and diagnostic tests right across the country. So the purpose of the task force was to eliminate those backlogs and get people the care that they need following an extensive backlog that was created by the pandemic. So yeah, I do stand behind those decisions, absolutely.